Every setback brings hope. Every seemingly desperate time brings new lessons. Every challenge brings opportunity for growth of mankind at large. Every night is followed by a new morning. In this current coronavirus disaster, we have seen the best of the human spirit. Healthcare professionals hard at work, disaster planning, going above and beyond, even putting themselves at risk for mankind at large. People drastically changing their way of life, accepting social distancing for the good of society at large, particularly the sick, the elderly, and the immunocompromised. Shops offering free food as a gesture of kindness. Many of our local neighbours offering to shop for the elderly, the immunocompromised, those with nobody, families looking out for each other, and much, much more. Today, in both my professional and personal capacity, I would like to share a message of education from the medical side on coronavirus. A message to aid the work of my fellow healthcare professionals and public health efforts, and from a completely personal side, a plea for the voiceless amongst our friends on earth. So let's jump right in to coronavirus and the medical side. What are the common symptoms? Some common symptoms we know of: cough, fever, and shortness of breath. The virus seems to start with a fever, followed by a dry cough, and then, after a week or so, leading to shortness of breath, and some patients needing hospital treatment and even lung support. Other symptoms that we seem to have heard of include headache, muscle pains, diarrhoea, GI symptoms. We must stress this is a very, very new illness and condition, and so many atypical cases will also emerge, and it's difficult to give very, very clear advice on the ratio of the symptomatology. So, cold, flu, coronavirus, how can we differentiate between them? This diagram shows some of the common features of all of these. One must stress, however, that this is still very experimental and there can be a lot of overlap. One key thing does appear to be that when coronavirus gets severe, shortness of breath seems to be a common feature. Certainly, in my work that I do as one of my roles in NHS 111, we are starting to advise, as well as all the government advice on social isolation, social distancing. We do say that if with these cold-like other symptoms you get shortness of breath that's so bad you think you're requiring oxygen, that could be a sign of progression of coronavirus and needing hospital treatment. So how can we prevent this coronavirus? Well, things that we've heard and we know about include washing hands with soapy water, avoiding touching eyes, nose, mouth with unwashed hands, avoiding close contact with people who are sick, covering the mouth, etc. This diagram shows hand washing techniques. You may pause this video at your leisure to see it in more detail. What is social distancing? Our government has talked about it. We've seen it with lockdowns. What is the idea? Well, at the moment, it's the only tool we have to fight the spread of coronavirus that goes from person to person, using them as hosts. And vaccine may be 12 to 18 months away. Apart from this, what other things are we looking at? You may have read conflicting evidence on ibuprofen, paracetamol. Some people saying ibuprofen and anti-inflammatory drugs can dampen the immune system, slowing the recovery process. My view? As far as possible and until clearer evidence emerges, I personally would prefer to take paracetamol instead of ibuprofen if it's enough for cold flu-like symptoms. And then, when clearer evidence emerges, we can update more. This next part of the video is a highly personal aspect for my own faith community, but you're welcome to listen, particularly those of this mindset may find it interesting. So, the origins of Covid-19. Well, it's believed that with the market in Wuhan, live and dead animals were sold together for consumption by humans, including all sorts of animals, wolf cubs, crocodiles, many creatures. And the theory says that this kind of mix of humans, live, dead animals makes it extremely easy for zoonotic viruses, transmittable from animals to humans, like Covid-19, to gain a foothold and spread. And these meat markets were believed to be an incubator for a species jump. As a medic in a multicultural society, I fight disease and ill health daily. And this second part of the video is how I'd like to try to fight it from a personal and spiritual point of view, separate from my profession. Let's look at coronavirus, SARS, MERS, swine flu, bird flu, mad cow disease, or CJD. What can be a common link between all of these conditions? Common link is the spread of poor, innocent animals. Often, my personal belief is through consumption to humans. One of the things we can do, regardless of our beliefs on this causality, is extending this compassion that we've extended to the elderly, the sick, the immunocompromised, this great human spirit that has emerged from this disaster to help all mankind, this kindness. We can also extend it to the voiceless amongst us. Great opportunities seldom come, as we said earlier, but small ones surround us every day. May our daily choices be a reflection of our deepest values, and may we use our voices to speak for those who need us most, those who have no voice, those who have no choice. Just as one wants happiness and fears pain, just as one wants to live and not die, so do other creatures. In conclusion, I hope this information, medical information on COVID-19 has helped. The public health measures that our government is putting together, I'd like to reinforce. And let's join forces with our government, our health professionals, and all work together globally, truly focusing on what's truly important in life, help each other. And from a personal slant, my added message, apart from my medical profession, is if we can be a voice for the voiceless, extend the good karma, and perhaps, according to some people's beliefs, stop the causality of many of these conditions to further kindness to other creatures too, it would be a great addition to the current messages. And a personal plea, certainly to those of my community, but any others who resonate with this message, please do reach out and connect with me, and be great to hear if this has and can inspire in any way also. Thank you. I hope you all liked this video message. Please, if I have offended anyone in any way with it, it's not at all my intention. I respect all of your beliefs in this multicultural society, and thank you for listening. God bless all of you.